All right, let's take a check of those major health insurer stocks for you. Kind of mostly down today in a day which we're mostly down. Humana up just about slightly there, about 0.5%, third of a percent, but overall health insurers just slightly lower. Talking of which, President-elect Trump in his first 100 days of office pledged to repeal and replace Obamacare. And guess what? I think we're almost at that point. Let's bring in Betsy McCaughey, author of Beating Obamacare. How and what, though? The question is, Betsy, and welcome. Normally you're here with a giant folder that was Obamacare. You, from the very beginning, beat the drum saying this is not going to work. And every step of the way, I got to say, you were exactly right. And once the cards started to fall, with big insurers pulling out, making huge losses, and just said this is not workable. The premiums go up. People had horrendous deductibles and everything else. We are at the point now, although President Obama will tell you, no, it's still working great. More people are insured. I know that. But you don't have the folder with you.
That's right. I didn't bring it because it's over. It will be repealed very quickly.
Now.
And let me tell you, ignore the fake news. You hear many people saying 20 million people who are newly covered under this law will lose coverage. Not true. First of all, 16 million of them are on Medicaid, the public program for low-income people.
They're covered anyway.
That's right. They're covered anyway, and the states that expanded Medicaid will not do a 180 and shrink it again. So for the most part, you don't have to worry about those 16 million people. The Republicans are planning on block granting the funds in order to ensure that for every dollar spent on Medicaid, there's more health care improvement, better medical care.
So what do we do now? We repeal. There's been two schools of thought. Keep those parts of Obamacare that work. Are there parts of Obamacare that work?
No, there will be protection for people with pre-existing conditions. I hear about that all the time. But it won't be by coercively and sneakily imposing the cost of those, the care for those very high-cost patients on the young and healthy. Instead, in each state there will be a high-risk pool funded adequately so that people with pre-existing conditions or cancer, for example, will be able to get insurance well subsidized so they can afford it. And that means for the other 5 million people currently in those Obamacare plans who are young and healthy, they're going to see real improvement. They're going to see their premiums stabilize or go down, much lower deductibles, much more affordability. Right now, they're technically covered, actually, but they can't cobble together enough cash to see a doctor because they can't get over that huge deductible.
They're just going to take a risk. They feel they're young, they're healthy, I'm not going to get sick.
That's right. So improvement for all three groups of people.
Very good. Smiling broadly. Let me ask you about, we talked about this week, perhaps a proposal out there to, I use the word privatize because that's the word that's being bandied about.
Mostly by Trump's opponents.
Okay, so, we're talking about the veterans a bit. What is it?
Choice.
Okay.
What Donald Trump and his supporters are discussing is giving vets more choice. They were supposed to get that choice when a law was passed in 2014, allowing vets who were languishing on waiting lists to be able to go to a civilian doctor and get Uncle Sam to pick up the tab. But the law erected so many hurdles, it was so difficult to use because it was really protecting the unions, not the vets. So unfortunately, very few vets got to go to those civilian doctors, and the waiting lines are actually longer now than in 2014.
How does the Trump administration change this?
Well, it's a very clever idea. Give vets choice. Give them a Medicare card that says, if you choose to leave the VA for your care, you can go to any doctor who takes Medicare, and Medicare will pay the tab. Don't rely on the Veterans Administration to pay that bill because doctors know dealing with the VA is a nightmare, right? But Medicare will pay the tab. And this is not going to cost taxpayers a lot because amazingly, actually, 47% of vets using the VA are already on Medicare. They're just using the VA in part because they don't have a copay there.
Why wasn't this suggested before? It just seems so simple.
They're going to be able to go to the civilian doctor. It's almost revenue neutral. It's going to be a great bargain for the taxpayer and a blessing for vets who need immediate civilian care.
A win all around. Great stuff. Betsy McCaughey, you're smiling, you're happy, you don't have your giant folder with you. It's all good, very positive.
Happy New Year.
Yeah, Happy New Year to you, Betsy. Thank you.